Hello, my name is Chloe Beecham and I'm an incoming PhD student at Georgia State University. Today I'm excited to share with you my work as a research coordinator at the Marcus Autism Center within Children's Healthcare of Atlanta and Emory University School of Medicine on behalf of my colleagues Morgan Reed, Jessica Bradshaw, Mina Lamba, Lindsay Evans, Scott Gillespie, Cheryl Clayman, and Shana Richardson. Our study, Screening for Autism Spectrum Disorder, Profiles of Children Who Are Missed, was just published in the Journal of Developmental and Behavioral Pediatrics. We examined the important topic of children with ASD who are not identified by common parent-report screening measures. First, I'll talk about what autism spectrum disorder, or ASD, is, and then I'll tell you more about how we screen children for the condition. ASD is a neurodevelopmental disorder that is characterized by deficits in social communication and social interaction, as well as the presence of restricted interest and repetitive behaviors. Clinicians can reliably diagnose ASD as early as 18 months of age. Given important research showing that early intervention leads to optimal outcomes, the earliest identification of children with ASD is critical. Screening measures are one of the tools used for the identification of children with concerns for ASD. The American Academy of Pediatrics, abbreviated as AAP, recommends an ASD-specific screener at the 18-month and 24-month wellness visits. One such screener is the MCHAT-R, which stands for Modified Checklist for Autism in Toddlers Revised, and it is a 20-question questionnaire that targets autism symptomatology. The AAP also recommends a broadband developmental screener, such as the Ages and Stages questionnaire, which we abbreviate as the ASQ3. This is an age-specific screener that measures 5 developmental domains, looking for delays in any of them. Prior research suggests that using these two screeners together leads to the highest ascertainment rate of children with ASD. However, little attention in the literature has been given to those children who have ASD but are missed by these commonly used screeners. When children are not flagged for further evaluation, a diagnosis of ASD will be delayed, missing valuable time for interventions to begin. Our unique study design allowed us to categorize parental concerns and examine the profiles of these children who were missed. Our study included 154 children aged 16 to 42 months, with 124 of those children receiving a diagnosis of ASD. Parents completed both the MCHAT-R and the ASQ3. Children participated in a diagnostic evaluation by psychologists, which included the Mullen Scales of Early Learning and the Autism Diagnostic Observation Schedule, 2nd edition, or the ADOS. This allowed us to accurately characterize children presenting with concerns. For our analyses, we chose to highlight the communication domain of the parent-completed ASQ3, given our research as well as prior research showing this domain to be the most predictive of ASD. When adopting the combined screening approach, using a flag from either the MCHAT-R or the ASQ3 communication domain, 93% of children with ASD were identified, as compared to the 85% ascertainment rate of the MCHAT-R alone and the 82% ascertainment rate of the ASQ3 alone. Despite the benefits of a combined screening approach, there were still children diagnosed with ASD that were not identified as having concerns on either screener. Our results showed that children who were missed by the MCHAT-R had significantly higher scores on all administered domains of the Mullen and significantly lower scores on the ADOS. This means that these children had higher developmental skills and milder ASD symptomatology when compared to children who were identified by the MCHAT-R. Additionally, our results showed the same pattern of higher Mullen scores and lower ADOS scores for children who failed the communication domain of the ASQ3. When investigating open-ended questionnaires completed by parents, we found that parents of children who were missed by these screeners still voiced clear ASD concerns, such as limited eye contact and repetitive behaviors such as lining up toys or spinning. Despite the well-documented benefits of screeners, also demonstrated by our study, our results showed that some children with ASD were still missed by both widely used measures, the MCHAT-R and the ASQ3. This was a sample of parents who initiated contact with our study reporting clear ASD concerns. These findings show that it is imperative that healthcare providers attend to parental concerns in the context of screeners in order to make appropriate referrals. Although children who were missed by the screeners exhibited higher developmental scores and less ASD symptomatology, even these children presented with below average developmental skills. Therefore, it will be important to replicate this study in a sample of children with ASD concerns and higher developmental skills. I'd like to encourage you to read more about our findings in the Journal of Developmental and Behavioral Pediatrics. Thank you to the reviewers and editors and to all of the families who participated in our research.